Subscribe to our YouTube channel and press the bell icon to get the latest updates.
The Print Off the Cuff, presented by IIFL Wealth and Asset Management, powered by Raheja Corp, corporate partner AU Small Finance Bank, in association with global insurance brokers, airline partner SpiceJet, healthcare partner Pharmed Limited, in alliance with Indraprasth Apollo Hospitals.
1 year from where it started, there are pros and cons. What I would say is that there's been a lot of learning in the last 1 year for us as clinicians who have always been talking of pandemics but really didn't have to go through a pandemic of this nature. And for, administrators in terms of the changes that one had to make. And I think for the nation in terms of a lot of realization of how health should be in the center stage, how we have to be resilient enough and innovative. Because we started off with a situation which looked very, very gloomy in the sense that we had very few labs. We were importing PPEs. We were not making N95s. We were scared that we would have shortage of ventilators and we may have to share ventilators between patients because that was what was happening in Spain and Italy at that point in time. And then a lot of things sort of fell together. We started working aggressively during the lockdown, having COVID care centers, working on having enough oxygen supply. People came together who were not in this business to start making PPEs, N95s, ventilators. And I think that has been the learning. But there's also been a lot of learning in terms of how do we balance our health sector with economy? How do we really look at everything in a holistic manner? And how do we really keep people following COVID appropriate behavior for such a long period of time? So how do we really look at things like behavioral change? And finally, I think one other thing that we have learned is the importance of research and development, because a lot of R&D which we were not doing came in, and that helped us in getting our own vaccine.
We know that we got tired of COVID appropriate behavior and we declared victory too soon and are paying for it now.
That's true. So what I would say is, this is not a new phenomenon to begin with. If you go back to the 1918 pandemic, the Spanish flu, and that was a time when we had only, influenza appropriate behavior, if I may use that term.
Right.
And that was what we call in sort of medical parlance is non-pharmacological measures. Physical distancing, masking, washing your hands. There were no drugs available in 1918. People really had no influenza vaccine. There were no antibiotics. We had a huge amount of people who died. Almost 7 to 10 million people in India itself died.
5% of India's population.
Yes, exactly.
Like that at that point.
So a large number of people in India died because of that flu. And if you look at the history then, after the first wave, when the number of cases came down, despite a lot of fears, people sort of did not have appropriate behavior. They started having parties. They felt now influenza is over. And that led to a huge surge subsequently. History is repeating itself in many ways. And that's why I'm saying that this is human nature, which we have to really see how we can address. That is one of the challenges that we have today.
As a clinician, what have you learned in this 1 year on how to treat a COVID patient? And are we able to save a lot more lives now? And if so, why?
So yes, I think we have learned a lot. We started off with knowing nothing about the disease. We thought it was like a viral pneumonia. And therefore, the initial treatment were even giving an anti-HIV drug, hydroxychloroquine. Yet, as research happened rapidly all over the world, we realized 2 or 3 things. One is that this is a disease, this is a virus which causes predominantly a viral pneumonia, which leads on to severe lung infection. But it also has a lot of systemic effects. And therefore, it leads to clotting, which can happen in various organs. It can happen in the heart. It can happen in the brain. It can even cause clotting in your lung vessels, leading to what was called happy hypoxia, that could be a mechanism that your saturation is very low, but you don't realize it.
Now this wave will come, 60,000 have happened. Maybe it will again go to 1 lakh a day. But the fear factor will be less this time than before, or should be less. Or people who are sick or their family should worry less.
So this is a tough question, but I do feel two things. One is that because of the knowledge that we have, we would be able to save more lives now than we were able to do in the past. But that doesn't mean that we will save everyone. And that is why you should be concerned, because it could be a young person, it could be an older person. Unfortunately, if he has a huge cytokine storm or goes into sepsis, the mortality is still high. Secondly, I think we are also now rolling out the vaccine. So I'm hopeful that since we are covering the high risk group first, it should give them some protection, and that should also help in a lower mortality now that we are seeing this new surge in the number of cases.
Are you satisfied with our vaccine rollout as yet? Or could we have done better?
So I think the vaccine rollout depends on multiple factors. One is having enough doses. You must have enough supply to meet your demand. And if you don't have that, you will have to prioritize your vaccine rollout. Second issue is, how do we reach out to the whole country? We have already a good universal immunization program, but that program focuses only on children and pregnant women. We have never really looked at adult vaccination of the scale that we're doing at right now. So there are humongous challenges, both in terms of vaccine delivery, in terms of having the vaccine, maintaining the cold chain, then having enough vaccinators, and being able to vaccinate the huge population that we have. So if you keep all of that in mind, and the let's say the challenges that our healthcare structure has, I think we've done a pretty good job. This is probably going to be the largest vaccine program in the world. We would cover many countries in Europe as we go along vaccinating, and in terms of the numbers that we vaccinate. But one would really like that we are able to accelerate the pace, get over the vaccine hesitancy, and get more and more people come forward to get themselves vaccinated so that we can move down the priority list as early as possible.
In fact, that's a good point you make, the size, because I think I was watching you on some TV channels yesterday on their COVID discussions, and I saw a little ticker running at the bottom saying Denmark has decided to continue to keep AstraZeneca vaccine on hold. And I thought, why are we highlighting Denmark? Denmark is population of just about 6 million. It's less than 1/3 of Delhi. On 2 good days, India is already vaccinating that many people, the population of Denmark. So they can pick and choose and say, "Mujhko ye nahi chahiye, mujhko ye nahi chahiye, humko to sab chahiye."
That's true. That's true. That is what I'm saying. We have to look at it in terms of the population we need to vaccinate.
So I know that you are vaccinated. You did that very early on to inspire others and to try and take away vaccine hesitation. I'm vaccinated. I think you had Covaxin, I had Covishield, so whatever our hospital had. Should one make a choice between the two or between any vaccines?
So when you look at the data, and I have a rider, a lot of data is industry driven rather than actually being very scientifically looked at.
Right.
If you look at the data, there is really not much to go say that A is far superior than B. And one would say that with the available vaccines that we have, there is not much to choose between the two. And therefore, we should go for whatever is available to us, and we should get ourselves vaccinated. We need to protect ourselves and our population as much as possible. And I personally feel that it is important for healthcare workers to get themselves vaccinated. If you want my advice, I would say it is mandatory for them to get themselves vaccinated. And why I'm saying this is because it's not your responsibility to protect yourself alone. It's your responsibility to protect your patients. Let me give you an example. Suppose I don't get myself vaccinated because I feel it's my right and I don't want to get myself vaccinated. But suppose I have COVID and I have mild COVID or I'm asymptomatic with COVID. We know that 30 to 40% of people are asymptomatic but still infectious. And then I go to a ward and I take the round and I give the infections to someone who's on a ventilator, who already is sick and his lungs are bad, and now we give him COVID. We are giving him a death sentence. Or I go to a transplant unit, a person who is on immunosuppressants and has just had a transplant or he is getting chemotherapy. So I think as doctors, for our patients, to protect our own patients, we should get vaccinated. And that's why I feel it should be mandatory for doctors and healthcare workers that they must get themselves vaccinated, not only for themselves, but for the patient in them.
I have a double question from a doctor, Dr. Jagdish Chinapa from Manipal Hospital in Bangalore, who says that now there are many mutants in India now, I think 700 plus, but 10 are prominent. So do you think the vaccines that we have are able to handle those variants, the Brazilian variant, the UK variant, the South African variant, and this double mutant that's come up in India?
So I think the important issue is to understand that when we look at mutants or variants which develop, they will develop with the type of virus that we're seeing. The RNA viruses tend to mutate a lot. It happens with influenza also, it happens with corona also. And therefore that is something that will happen. There are certain mutations which you call the variants of clinical significance or variants of interest, which are those which can cause problems. And the problem that I see is the three broad problems that they can cause. One is they may be more infectious and therefore cause more disease. The other is they may be more lethal. They may cause more deaths. And the third is they may develop an immune escape mechanism so that those who have got the infection in the past may get reinfection, or those who have been vaccinated will also get have less protection from the vaccine and therefore get the disease later on also. So now if you look at the three variants that we're talking of, the UK variant, the South African variant, and the Brazilian variant, the data suggests that the vaccine is effective in terms of preventing severe disease as far as the current vaccines are concerned. That is also to some extent possibly true, although we don't have enough data as far as double mutants is concerned. And therefore the vaccine should work to some extent. The efficacy may come down to some extent as far as these variants are concerned. But that doesn't mean that we can sit back and say that we need not do anything. The virus will continue to mutate.
Would you think, and this is also something that my colleague Avantika Ghosh, who you know well, she's asking, that given that some districts have the highest burden of India's COVID cases, some states and there are some districts, maybe 50 districts, 60 districts, would we have been better off focusing our vaccination effort on those first?
I don't think so. So let me try and explain this also. You see, no area is an island, and you have to look at decreasing mortality for the whole, let's say, country if you can, rather than one district, because the virus will travel from one area to the other. There is no way you can prevent that. And also, if you are focusing on vaccinating one area, we must remember that by the time the vaccine effect kicks in, it's going to be almost 6 weeks. You take the first dose, you take the second dose, and 2 weeks after the second dose, will you say that you have enough protection that you will get some protection from the number of cases. By that time, the pandemic will have moved on. This is an important thing to understand, that this is a pandemic which tends to move. It started off from China, went to Spain, Italy, then moved to the US. In the US also, we had this huge surge in New York and not in other parts of the US. And now we saw a huge surge occurring in the West Coast and other parts of southern part of the US. So this pandemic will move from place to place as people travel and carry the virus because of the fact that many people are asymptomatic. And therefore, vaccinating one area will not be a holistic solution.
So Sambit Dash, he wants to know that, there was a statement from the government that lots of vaccines are being wasted, and there was also a ranking of states which are champions on the wrong side of it. So when vaccines are going waste, why not give those to people who may be below 45? Why let them go waste?
So I agree that we should not let them go waste. But if we don't want to let them go waste, we need to develop a strategy that we give it to those who need it the most. So it's an issue of not that there is no takers, an issue that we need to develop a mechanism that we are able to give it to all those who are in the priority list and we are not able to reach out. The reason why they're going waste, I think we should understand. We don't have one ampule for each individual. We have one vial which has 20 doses for Covaxin. So if you have a person who opens a vial and there is at 4 o'clock and only 2 people turn up, then that vial will only be able to vaccinate 2 people. The remaining 18 doses will go waste. On the other hand, if we had a huge number of people turning up and there was no vaccine hesitancy, and we had more than the number of people who were to be vaccinated at that center, we could finish that and ask the others to come to the next day in the morning, and we would have no wastage. So we have to really develop a strategy where either we develop a mechanism where the entire vial is used, or we are able to share it with other centers nearby if they have more people and they are about to open a vial. So a strategy can be developed where multiple vaccinating sites can coordinate so that there is no wastage. By opening it up to others, we may still have a wastage, because if you open up a vial for people under the age of 45 and at the end of the day you have only 2 people left and you have to open the whole vial for 2 people, 18 doses will still get wasted.
2 states in India today are in particular cause of concern. 2 states are very far apart. They are very different from each other. One is Maharashtra and one is Punjab. Now, Maharashtra has a very high number of cases and also case fatality rate that's higher than the national rate. But then you have Punjab, where the case fatality rate is almost 2.5 times higher than the national rate. So, would you talk about both these states? Is there something peculiar about each one of these?
So, both states, in Maharashtra, one of the issues that is there has been a rapid rise in the number of cases. And I think that is related to multiple factors. One, of course, is we all know, which is there all over the country, lack of COVID appropriate behavior, crowds. And you just need one crowded event in which you have a person who is highly infectious for that to become a super spreading event and suddenly a spurt of cases. Once that happens in a region and people start traveling out from there to other areas, which happens a lot in Maharashtra because people travel a lot, from the cases will get exponentially increased in different areas in that state. But that will also lead to subsequently lead to cases increasing in other states also. Secondly, we need to really do a lot of sero surveillance to see whether there is some new variant coming up in that area, which is also driving this. And thirdly, of course, there are states where in terms of the density of population is much higher than others. And the density of population means that there is a higher chance of the virus spreading in that densely populated area and causing much more cases, as could happen in another smaller town where people are not that densely sort of crowded in 1 square kilometer, if I'm used that way, in terms of population density per square kilometer. So these are factors which can...
So could it be because Maharashtra is also testing at a level that is lower than the national average?
So testing is one of the most important parameters that we have, because what are we looking at? And that is another thing that I would like to highlight, is one thing that many states have stopped doing, is what we started off with: testing, tracking, isolating, and treating. What does that mean? It means that you have to ramp up your testing, and each person you test, you do a detailed contact tracing. Who did he meet in the last 24 to 48 hours, 72 hours? Who are his close contacts? Test them, quarantine them, and break the chain of transmission. But currently that has totally stopped. You test the individual, he's positive, you start isolating him, you don't really do the tracking part, and you don't do the contact tracing, and therefore you allow the virus to spread in the community. And many states have given up on that testing, tracking, and isolating philosophy, and that is why we are seeing this huge surge in the number of cases. We have to go back to that.
Our young reporter Sonia Agrawal, she wants to know, when do you think schools can open?
That's a tough question now with the rising number of cases. When the cases were coming down, people are hopeful that schools will open, and people are hopeful that the vaccine will also be available for children. Those are the two challenges that we have, because in schools, we know that it's going to be very difficult to have COVID appropriate behavior, and therefore there is a high chance. Luckily, children have very minor infection. They usually have a mild infection. The fear is that they may carry the infection to their house and give it to the elderly at the home, and therefore cause severe infection. There are trials going on as far as vaccines for children is concerned, but we must understand children are not little adults. So we can't just extrapolate the data from adults to children, because the dose is going to be different. We have to really know what is the dose of the vaccine which works as far as children is concerned. It can't be half dose because they're children. We have to have the correct dose. And we also need to be doubly sure that it is not going to cause any serious side effects as far as children are concerned. Most vaccines are now going through trials in children. So I'm hoping that this result will be out quickly. An ideal situation would be what we had for flu, is to have a nasal spray which can quickly be given to a large number of children in a short period of time, and they were also not reluctant because it's just sprayed into the child's nose and it gives them.
Mohana Basu wants to know that, her question is, several brands are using immunity boosting tags. Immunity boosting. I see air conditioners for immunity boosting, fans for immunity boosting, water for immunity boosting. I mean, what are the ethics of this, or how real can it be? Is it all fake, or do you see some merit in this? Is there any science to this?
There is no science to it. There is basically, if you are taking a good healthy diet, if your diet is good, you exercise regularly, your immune system is good. You don't need to have immunity boosters. That really doesn't help. You could argue that this will help you in terms of decreasing the pollutants in the air. There are large number of devices. Some of them are even put up saying that, like, you have air purifiers. They will purify your air and kill the virus if it's there in the environment. There is no data to support any of this. Therefore, I don't think we should go by whatever is put out there unless there is a good scientific data to back it. Currently, there is no scientific data to back the immunity boost which has been promoted in the market.
So the only device that boosts immunity is this, the mask.
Correct. This will protect you, and if you and the person who you are talking to or who is you're coming in contact with is also wearing a mask, it will protect both of you doubly and prevent you from getting the infection. So the mask is as important as the vaccine in terms of infection control currently.
The Print Off the Cuff, presented by IIFL Wealth and Asset Management, powered by Raheja Corp, corporate partner AU Small Finance Bank, in association with global insurance brokers, airline partner SpiceJet, healthcare partner PharmEd Limited, in alliance with Indraprasth Apollo Hospitals.